So this is a question we get asked a lot of times. What sorts of jobs will I be able to do when I finish? It's a valid question. It's a very valid question. Obviously, you'll be investing a lot of time and money and effort into doing the master's, so you want to know what you can get out of it. Well, for some of you, you will be coming already established in your jobs or in your businesses. So obviously the addition will just help you get a better outcome and improve your businesses and, maybe promotions. But if you're coming in straight from the undergraduate degree or as an international student looking to come into work, you might be wondering what kind of jobs are available. Faith, do you want to talk us through some of them?
Yeah, so like Nenadi has said, it really depends on where you're coming from. So for the current workforce, for many of you, it is about just moving on to the next leadership position, and the opportunities you get through this course will allow you to do that. If you haven't got the experience yet, well, we offer experience to learn and get some work-based experience through some of our units. And that allows you to start to think about things like being an implementation manager, working in health evaluation, health improvement, in digital health, in health advocacy, or leading in social prescribing units, so managing entire social prescribing networks in the community. Bear in mind, this is mainly focused on primary care networks, but if you already have clinical experience, you can also do far much more. So the course is really tailor-made for depending on where you're starting from, and we will help you build on the required expertise to go into various roles that are on offer in the integrated care kind of milieu. Bear in mind that this is an emerging field, so what we talk about here is not exhaustive. By integrating health and social care, there is a wide range of opportunities that are emerging, and we're going to kind of build into that and learn what those are as well as we go along with the course.
Another option is research. Some of you might be on the pathway for a PhD. So we're trying to see if as many people as possible can get involved in health research to develop what we know about integrated care systems and integrated care bodies. So there will be a pathway to PhD studies because we are linked and we're in touch with the Institute of Health Research and, as well as our own
Applied Social Research. Yes.
Yeah. So one of the interesting things about this course is that when you study for whatever level, so even if you do the PG cert, you are awarded an award or recognition for the Chartered Managers Institute, CMI. So, that is quite a valid recognition to get, and it sets you on the pathway to leadership and management. If you decide you want to become chartered, the CMI will work with you to decide what the options are for you. So if you already have some management experience, they can use your experience and probably wouldn't need to write an exam, or they'll use your experience to be able to decide what works best for you. But even if you have no experience at all, they will guide you towards what's necessary for you to do to be able to become chartered. But by only being on the course, even if it's a PG cert, you do get the recognition. So you get an award for level 7, which starts you up on the process towards that. Practically speaking, the course is based at the Luton campus, which strategically is quite interesting and very good. We're very close to London, we're close to the airport. Heathrow Airport is about 45 minutes away. We have local links with Health Watch and a few other organisations. So you're getting a good feel of what integrated care is, and you're getting practical experience of how local communities and local health agencies are working together to deliver better outcomes for our citizens.
Just to continue what Nenadi is saying, one of the main instruments when you read the integrated healthcare policy is that we develop place-based partnerships. And so a lot of your learning is going to be around understanding how the local area works to kind of work to bring together health and social care. So we have very strong partnerships with BLMK, which is the Bedford Luton Milton Keynes Integrated Care Systems, and we are working closely with the Integrated Care Board. The university currently has a really interesting research project going on with them. So you're going to really be at the heart of an anchor institution that is piloting what integrated care systems look like, and we're working actively with all our local place-based partnerships. So you're not just going to sit down on a typical thought master's program. You're going to be learning from applied and real-life experiences, which will reflect in your teaching. So case studies, meetings, you will feel as if you are at the heart of this whole piloting of what integrated healthcare systems are. So we hope that you join us.
Yeah,
you know,
we're looking forward to meeting you. If you have any questions, if you're interested in finding out more, we have a range of open days organized, both face-to-face and online. So drop us an email or contact us if you want to talk to us about anything. This is not just all of us. We have our colleague, Mark Kane. Mark is our specialist in integrated care, and he will be delivering the core unit. So any of us, if you have any questions for any of us, we're willing to answer your questions, and we look forward to seeing you soon. Thank you.